Dr. Gottlieb, let's start with this potential good news about a vaccine candidate from Moderna. How optimistic are you?
Look, I'm optimistic that we're going to have a vaccine. I'm on board of Pfizer. They're also developing a vaccine against COVID. I think all the incremental information that we've seen from the different vaccines in development leads us to believe that it is possible to develop a vaccine against this virus. And one or more of these manufacturers is likely to be successful. I still think that a vaccine available for mass inoculation of the population is likely an early 2021 event. I think if we have it available in 2020, it's likely to be for a selected population, maybe under an emergency use authorization. But I do think that we're going to get a vaccine to COVID. There's three basic strategies being pursued. One is using viral vectors to deliver the protein that we want to develop immunity against, the protein that this virus expresses called the spike protein. Another are these mRNA approaches. That's what Pfizer's taking. That's what Moderna's taking. And then under this approach, you basically deliver the genetic material that codes for that protein. So you give the person that genetic material, then they start producing the protein. And then once that protein's in your body, you develop antibodies against it. And then the third approach is to just deliver the protein directly. And this is sort of an old style vaccine. This is what's being pursued by Sanofi and Novavax. So there's multiple strategies, multiple vaccines. All the data that's been turned over so far has been encouraging. Still early days, but we're encouraged.
So just slow that down a bit for us, because people talk about a vaccine like this is magic and we're going to rush and get right back to work. When you see these headlines, it's obviously a positive for the stock. But for the everyday American, if one of these vaccines, let's say it works, let's say it gets approved by October, when do you think the American people en masse will take it and then can actually get back to the lives we used to live?
Yeah, well, look, I think it's unlikely to be approved by October. I think that the clinical trials could potentially start reading out in October, maybe late September. And that's because, unfortunately, we have so much infection in this country. The trials are likely to go quickly. One of the concerns early on was that you would have trouble enrolling the trials, and then you wouldn't have enough events. You wouldn't have enough people getting COVID in the population to tell whether the vaccines are working. So you'd have to wait longer until enough people got infected. We're not going to have a hard time enrolling these trials and getting enough events right now in the United States. So these trials could enroll quickly and read out sooner than we thought. So assuming they start to read out in the fall, figure the October timeframe, you still want to do long-term follow-up. You want to follow patients for 3 to 6 months to make sure there's no side effects before you're going to license it for broad use by the general population. Plus, the supply is unlikely to be available until towards the end of the year. So I really think in terms of being available for most Americans, you're talking about early 2021. Now, maybe it could be available for select populations earlier in 2020 under what we call an emergency use authorization by the Food and Drug Administration. And there you might license it for people like first responders, people who work in conditions where they're more likely to come into contact with the virus, or people who are more at risk because they maybe are older or have other kinds of comorbid conditions, other kinds of health problems. So you could see it given to select populations earlier, but I think for the general population, in terms of being able to go to your doctor and get a COVID shot along with your flu shot, that's really 2021, early 2021.
Then we're going to be living with this for a while, which is why testing is so important. And we've talked for months about contact tracing. If we're not even getting test results for those who can get a COVID test for 4 or 5 days, how can you possibly effectively contact trace?
You can't. You can't effectively contact trace when you have this level of infection. Contact tracing is useful when you get the infection rates down. So, Connecticut, Maryland, Massachusetts can do contact tracing. Florida, Texas, and Arizona can't. The other thing to look at in the data is that those states are hitting the upper limit of their testing capacity. So you're going to see new cases start to slow, not because infection rates are coming down, but they're hitting the upper limits of what they're able to test for. Arizona certainly looks like it's at the upper limit of its testing capacity. Florida and Texas are going to get there. So we're going to start to see new cases on a daily basis start to slow their velocity, if you will, the growth. And it's not because necessarily infection rates coming down. It's just because they've hit the upper limits. So we really need to look at hospitalizations to know what's going on in those states. And hospitalizations tragically continue to rise. Right now, there's 55,000 people hospitalized for COVID, which is almost back to the levels of the number of people who were hospitalized during the peak of the epidemic when New York was the major epicenter of spread.
Then, given all of this news that is not encouraging, you wrote an op-ed in the Wall Street Journal this week saying we can and should open schools this fall. I can tell you as a parent, I certainly want to. But how do they actually do it?
Well, the first thing we need to do is get the epidemics under control. So there are states where, the prevalence is relatively low right now, and hopefully it stays that way going into the fall. And they're going to have the opportunity to reopen their schools in those states. They may not be able to keep them open through the fall and the winter, but I think that there's an opportunity to reopen schools in states where the epidemics have gotten under control. But my view is the key is to give discretion to local officials to take steps to prevent outbreaks in the schools. And so that means de-densifying the schools, maybe going to a hybrid model where you learn at home for a few days and learn in the classroom for a few days, trying to keep cohorts of students together so the same students commingle with just the same students. Maybe stagger the school day so people arrive at different times. So the trip to the school, the bus ride to the school can be de-densified as well, making sure teachers have proper protective equipment because they're vulnerable too. I mean, the reality is we really don't know everything about how this virus behaves in children. And so to say that kids are impervious to it, that's simply not true. They might be at lower risk of contracting it and lower risk of getting seriously sick from it. But lower risk doesn't mean no risk. And if we create a situation where there's outbreaks in schools and this becomes epidemic in children the same way flu does, we have to be concerned that there's going to be a lot of bad outcomes. And so we need to try to continue to protect kids in the classroom as best we can. I think we can do that. But states where there's epidemics right now, I think it's going to be very hard for those states.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.